Okay, looks something like that. Now I'm gonna draw first the inferior, but I'm gonna finish drawing the inferior border. Okay, there, different color. You got the inferior. Border. Diaphragmatic surface. It forms the base of the lung. And let me draw. Try to remember which color I used. No. Here. There we go. We got ourselves a lingula. I should make this more like a tongue, Now each line is different in different people, but the same basic idea, like all anatomy. There are some variations. I'm gonna try to draw the edge here. A little bit like that, so that we can see the interior border. And let me repeat this, type it. This is the left line. Okay. So now I'm going to label the cardiac notch somewhere here. You know, in lab is when you actually can find these things, when you're actually looking at a real lung in a cadaver, or you know, whatever your school has for you to practice anatomy with. So this is to give you the general idea and just show you how I review. I want to make a little bit of a deeper groove here than the original one I had. something like that. We have here the groove for first rib. Okay. And for lingual, it doesn't have an R, by the way. So let me correct that. There's a groove for the subclavian artery. It's here. Groove for subclavian artery. I'm just gonna label the apex where I'm here. It's like, you know, the right lung also had the apex. Now let's label the area for the trachea and the esophagus. We had an area of the trachea, if you remember. For the right lung we had that, and we had a groove for the esophagus, if you remember this previous drawing of the right lung. But this is the left lung area for trachea. It's always good to compare and esophagus. And I'm gonna lightly make something, yeah. So now let me draw an area, yeah. All the way to the bottom so that we can get an idea for the groove for the arch of the aorta. I'm not the best artist at all. I'm not an artist at all, actually. So, let's see. This, I'm going to actually now I'm gonna it's a little bit too fat. There we go. That's better. We get the groove for. I'm just going to draw it from the, yeah, I mean write it from here. Groove for arch of the aorta. And groove for descending aorta. Pulmonary ligament is going to be there. I'm going to finish drawing it out in a little bit. And right there, we're going to have area of esophagus. I'm going to finish drawing it out soon. That's area for esophagus. And yeah, let me draw a little bit more. So I'm going to draw the highlight first. Not too far there. I might have to fix that. Let me draw the vessels first. That'll make it easier. I'm going to draw the pulmonary artery. So, right there. Pulmonary artery. Then I'm going to do the left main bronchus. Then I'm going to do the pulmonary veins. Okay, it's a little bit too big. Alright, now it makes it easier for me to finish drawing the pulmonary sleeve here. Sorry about that. It's getting late here, so I'm getting a little bit tired. And let's make it a little bit rounder. There we go. So it's not perfect, but get the idea. There you go. Here is the pleural sleeve. It's between the parietal and the visceral pleura. You might have to look at another image to see how where the pulmonary sleeve is. Okay, so let's label these things that I just drew before. Pulmonary, veins. Remember, it's the veins that carry the oxygenated blood, and the artery carries the deoxygenated blood. So the color reminds you of that. I didn't make it real red, but I used pink. And I used a purple-like color instead of blue. But you get the idea. Here you have for the bronchus, I need to make a little bit of groups here. Okay, so that we can label the superior lobar bronchus. Then we have the inferior lobar bronchus. Then we have the left main bronchus. Okay. And then we can label, well, this is the whole left main bronchus, by the way. So I'm gonna label the pulmonary ligament. Well, I already did. Okay, good. So we have what we need. We need to label and draw the bronchopulmonary lymph nodes. So I'm going to take a green color and go in here. Actually, I'll just do here so that it's less confusing. So here we go. I'll just let it go here. There we go. Bronchopulmonary lymph node. For the right lung, I forgot to label it, but that was it right here. Bronchopulmonary lymph node. There's another video that shows me drawing this right lung. And there it is on the left, bronchopulmonary lymph node. So that covers the whole hilar area. Good. So now that we labeled that, let's actually, for this one, let's number things before I go. Let's number things that are in the hilar. Okay. So let's number pulmonary artery, because that helps when you're reviewing to know that you covered everything. Okay, I forgot one thing that I should put. See, numbering helps you remember and review. I want to draw a bronchial vessel here. Bronchial vessel. Let's just make it 2. Make this 3. Make this 4. 5. 6. And make this 7. And pulmonary ligament. It's not really in the hilar, but let's just label it 8. Okay. And in the pleural sleeve, 9. Okay. So okay, that's it for the things that I want to label here. 9 of them. Now let's go ahead and draw other things like the oblique fissure. You have to draw it from somewhere here. Going, yeah. And let's draw another part of it where it's coming. So let's put it at an angle here so that I can draw it to here. And down. It's less oblique than I want it to look. I'm gonna bend it more. It just make it look something like that. It's alright. Oblique. Fissure. Okay. And we saw it there too. I used a different color. Sorry for that, but there we go. Oblique fissure. It might actually be a good idea to use a different color. Let's just stick with it. Okay, these are oblique fissure. Now let's draw. You just notice that for the left lung you don't have the horizontal fissure like you had on the right lung. Okay, here I want to I'm trying to fix this so that it looks a little bit more like a one. This groove, but as you can see, I am not an artist at all. Okay. So in the area, that's it. But we need to have a cardiac impression here, like we had on the other lung, but it's around this area. Here. Give the cardiac impression. Okay. We have labeled the groove of the subclavian artery apex, area for the trachea and the esophagus, groove for the arch of the aorta, oblique fissure. We labeled the groove for the descending aorta, pulmonary ligament, area for the esophagus. We labeled the inferior surface, the diaphragmatic surface, the oblique fissure, the lingular cardiac notch, cardiac impression, and again the anterior border. Now let's go over where the subclavian artery will be around the area of the subclavian. I'm going to erase this later if it doesn't look good. I don't think it will look good, but here it will be here. This will be where the artery will be at. And you will see that there will be the arc of the aorta and the descending aorta that will be going actually like this. That will be the descending aorta goes here. It will be going here in this area. It will be like big here. I am not good at art, but you can see where I'm getting at. And it will be the arc of the aorta will be arcing here, or arching here, like so. And so on. Something like that, and you'll be having the vagus nerve come to this area of the hyla. and the phrenic nerve coming here and going down. So this will be your phrenic, okay? So imagine, this is not perfect drawing. Imagine your subclavian artery here. I'm gonna label aorta. That would be the descending aorta here. You will have vagus going to the area, of the hila. It's going under. That's what it looks like, yeah. And then the phrenic nerve there. Okay, so that's about it for the main things. Well, in the thoracic duct will be somewhere here. That would be the thoracic duct. Okay, so I could I could screenshot this real quick for myself, but I think it's pretty obvious where everything goes. I'm gonna erase this. And as I do, you can be reviewing apex, area of trachea, and esophagus, oblique fissure, groove of the arc, brachial vessel, left main bronchus, inferior lobar bronchus, groove for descending aorta, pulmonary ligament, area of esophagus, inferior border diaphragmatic surface, oblique fissure, lingular, cardiac notch, cardiac impression, pulmonary veins, pleural sleeve, anterior border, bronchopulmonary lymph node, superior lobar bronchus, pulmonary artery, groove for first read, groove for subclavian. So there we are. This is the left lung.